Today, we're going to focus on biomedical therapy. So, remember, this is the use of medications or specific surgeries that deal with the physiology of your body. And so, our objective for today is going to be students will be able to differentiate between psychotherapy and biomedical therapy. And today we're focusing on the biomedical portion. So we're going to hop right into drug therapy, which is the first type of biomedical therapy that we're going to talk about. In most cases, we're going to focus on two types of drugs, antipsychotic and antidepressants. Antipsychotic drugs is what we use for anyone or a patient who suffers from psychosis and positive schizophrenic symptoms. Now, how this works is it is going to block dopamine. Remember, the dopamine hypothesis for schizophrenia is there's a belief that there might be too much dopamine in your system, which may give you the schizophrenic type symptoms. Antidepressant. Now, one thing to notice with this, is that it does not treat schizophrenia. You're not treating schizophrenia. What you are doing is reducing the symptoms of schizophrenia. If you remember the video that we watched with the professor who suffers from schizophrenia, it's a constant battle. It doesn't just go away. Once you have it, and you have to continue to treat it. Antidepressants is a second type of drug therapy that we're going to talk about today. And they work by typically, they work for, anxiety and depression. And most typical antidepressants are going to increase your norepinephrine or serotonin. As a way to address anxiety and depression. Now, one thing to note with when you're taking drugs or antipsychotic drugs or antidepressant drugs even, is there is a side effect that's called tardive dyskinesia. And actually dyskinesia. So tardive dyskinesia is when you have facial twitches or even facial paralysis, which is a side effect of antipsychotic drugs. Another type of drug that they could potentially use to address anxiety and depression is what we call an SSRI inhibitor. Which is what you see right below here. So what happens is you are releasing serotonin. So these little guys are your serotonin. And you're releasing serotonin, and you have your serotonin receptors, but what you don't want to happen is for the serotonin to go back into the sending neurotransmitter. And so you set up these blockers, which are right here. So therefore, the serotonin is either going to go to the receiving neuron as it should, or just kind of dissipate out. But what we don't want to see happen is for serotonin to go back up. And so this is stopping that from happening, which can also address anxiety and depression. So you might notice there's a couple of different drugs that deal with anxiety and depression, and that is accurate. That's why sometimes if you ever have to take one of these, they may kind of switch back and forth to try to figure out which one works best for you. Some other types of drug therapy are mood stabilizing medications, like lithium. Yes, lithium, the salt, for those of you that know lithium. And this can be very effective for bipolar disorder. Oops, sorry. And can also decrease suicide risks. Anti-anxiety drugs depress the central nervous system, so you're not as responsive. However, the downside to these is that it can cause physiological dependence. Meaning that you could start to get to the point where unless you have this, your anxiety gets worse and worse. That is possible. So, in addition to drugs, you could also use brain stimulation or surgery as part of the biomedical therapy. In many cases, this is a last case scenario. They try to use therapy and drugs before they get to this part. One of the first types of brain surgeries, or actually brain stimulations that you could go through, is called ETC, which is electroconvulsive therapy. And for electroconvulsive therapy, it's used for severe depression, as a last resort when there has been no response to medication. The second is magnetic stimulation, which is repetitive transcranial magnetic stimulation, known as RTMS. And this is where they activate or try to activate the left frontal lobe using magnetic stimulation. This, however, can lead to seizures. So again, this is going to be something that's done as a last resort when medication has not been, or they have not been responsive to medication. Third is called deep brain stimulation. And this is where they implant an electrode into your brain in an attempt to focus on the cerebral cortex between your frontal lobe and the limbic system. Again, kind of like trying to see if they can't jumpstart that part of the brain. And finally, we have psychosurgery, which is essentially a lobotomy. Some of you may be familiar with Rosemary Kennedy, JFK's sister, who they did have a lobotomy performed on and then kind of put her away for the rest of her life because she was essentially a vegetable after they performed the lobotomy. And this is a lobotomy is when they cut neurons in the frontal lobe. And reading more about her story is pretty interesting if you ever want to look her up. There's a lot of controversy over whether or not she would have needed a lobotomy. And then there's two additional treatments that fall under biomedical. The first is what we call eye movement desensitization and reprocessing. This is where they use rapid eye movement to follow a series of lights while recalling a traumatic event. And this can be effective if there was only one traumatic event. So let's say you were in like a terrible car accident, but otherwise had a fairly normal life. This could be effective. If you have a lot of trauma in your life, this is probably not going to be effective for you. And then finally, light exposure therapy, which is what a lot of people do now while we're in the winter months. And you can buy a great little light off of Amazon that gives you the vitamin D that you need that might cause seasonal affective depression. And this is a great treatment for seasonal affective disorder. So the difference between psychotherapy and biomedical is going to use medication and surgeries to try to address psychological concerns, whereas therapy is going to use more of a talk or therapeutic response. These can be combined. A lot of the biomedical surgeries are last resort surgeries if therapy and medication has not worked.